So when we are going to do draping, we need to do a few things first, okay? And I'm sorry, I'm going to have to use my cheat sheet here also. I'm afraid I might forget something. So sorry. No, that's all right. So when you're going to drape, you want to, the first thing you want to do is you want to plan ahead. What area you're going to drape, or work on, excuse me, what area you're going to work on, what position you're going to have the patient in, and have all your supplies ready to go. You don't want to have someone half naked and say, oh, I'll be right back, I have to go get such and such, okay? So you want to have all those things ready for yourself. So I'm not completely ready here. I have my patient, but I'm not completely ready. So I'm going to grab a few things because I'm not quite sure what I'm going to need. Now that's not ideal to be reaching over the patient when you're doing stuff because you can drop stuff on them. And you don't want to do that, all right? So just have your things close at hand when you're going to get them. And if you are working in a skilled nursing facility and you are getting stuff out and you, oh, I dropped it on the floor, you don't pick it back. No. You don't pick it back up and put it on the patient, because if you've ever worked in a skilled nursing facility and someone, people are walking around, they've walked through BM, they've walked through urine, they've walked through blood, and they've walked through everybody's rooms, and there's stuff on the floor. So don't ever reuse something that you've dropped. You have to, unfortunately, get rid of it and get new stuff. Okay, we're not going to do that. Oh, sorry. Okay, so those are the things you really want to start with. Now, the other thing you want to do is you want to be confident when you're draping someone. You're a massage therapist, right?
Yeah.
Okay, so if if you walk up to somebody and you're like, hi, how are you? I'm Patty, and I'm going to be working with you today, and I'm a little, okay, so, she's not going to be very confident in me, right? So you're going to go up to your patient, and you're going to say, hi, I'm Patty, I'm a physical therapy assistant that's going to work with you today, and you are?
Chelsea.
Chelsea, that's what I thought. I just wanted to make sure you knew who you were. And so you shake hands, or you just introduce yourself, and you be confident about what you're going to do, okay? And then you want to make sure that you get permission from the patient to treat the area that you're going to work on. So you could say, today I noticed that the physical therapist wanted me to work on your shoulder because you've been having some pain in there. So we're going to work on your left shoulder today. Is that okay with you?
Go for it.
Okay, so you get permission to work on the area you're going to do. Especially if it's like, okay, we're going to work on that strain on your inner thigh, okay, but I'm going to drape you. So we're going to be working down in this area. Is that okay with you?
Mm-hmm.
Okay. Or on their buttocks, or, places that people don't generally like people messing around with or being in their area, okay? So you need to get permission before you do anything. Okay, so then you want to be able to provide them with extra temporary clothing. So shorts, a lot of outpatient clinics will have shorts that they just provide for the patient, because a lot of people are coming from work, they don't remember to bring their stuff with them, and so they may not have brought some shorts to have on for treatment. And actually, some people might have forgotten their underwear because they go commando, so they may not have anything once they take off their street clothes. They just are bare naked, and so you need something to put on them. Or they have gowns, which I don't have in that closet. So, or they have gowns. Okay, so you need to have stuff that you are going to let the patient get into to change out of their normal clothes, so you can access what you're going to be working on. All right, so then you're going to provide privacy. So if we were actually working on Chelsea today, I would pull curtains in this place, or if I'm in a room with a door, I'm going to shut the door so that it's just us. If you're working out in the gym, you're going to make sure that people can't come in, or you're going to use curtains around the person. Provide them some privacy for what you're going to. Even if you're working and it's on their shoulder or their back or something like that, you're still going to provide privacy. You're not going to just whip them out and whip up their shirt and work on them in front of a bunch of people that are in the gym. Okay. For you guys, And I would say for gals too, if you're working on the opposite sex, in a room, I have a student that's out right now in a clinic doing his full-time clinical, and the PT is, an owner of the clinic is a male, and he has a female PTA, and the student is a male, and so the owner is extremely nervous for him, the student, to be working with his female patients, because he normally just hands them off to his PTA to work with. Well, now he has a student who's a male, and he's like, and the student's going, he won't let me work on anybody, you know, I don't know what to do, you know, I always got to have the PTA in there with me, and I'm not seeing patients by myself. And, you know, I said, I totally get what he's saying. You know, he has worked this system out for himself. He gives all the female patients to his female PTA so that he doesn't run into any problems with his clinic, you know, to be accused of anything, because, you know, a lot of them are athletes. They've got strains and pulls and groins and, you know, and all sorts of stuff, and he doesn't want to have that liability. So you have to be careful when you're out there what you're working on. If you're working on an area and you're a male, you're working on a female, or vice versa, you have to think about those things. And how are you going to do that? How are you going to put yourself in a safe situation, the patient in a safe situation? So if it's a person that's younger and their parent came with them, you bring the parent in and have them sit in there with you. If there's a female aide, you bring them in and have them sit in there with you and help, you know, just be in the presence. If it's a guy, we don't usually tend to think about that much. If it's a female therapist and a guy patient, you know, usually, you know, they're just taking off their shirt and you're working on them. You don't really think about it too much, but, you know, as a massage therapist as well, I've had to consider those situations when I'm working on someone and they're pretty much bare naked under a sheet, and you're draping them and they're making comments, and you're like, okay, this is going to be your last. You know, I'm not seeing you ever again, because you just don't know where that's going to go. So you have to think about those things, okay? Okay, so let's pick an area here. Let's go ahead and I'm just going to show you how to drape someone initially. So first of all, how does she look? We're going to talk about positioning, but right for now, she doesn't look too comfortable. So I'm going to get her ready for treatment. So the first thing I probably want to do is give her something for her head so that she's comfortable. So if she can lift her head, I'm going to let her. If she can't, I would help her with that. I'm going to, let me help you here. I'm going to just lift your legs, okay? And, okay, get her comfortable. Ow. Sorry, okay. Oh, I don't think it hurt it. All right, so then, if this was all I needed to do, I would do if I needed to support her arms a little bit. I could do that too with some pillows or with some folded up sheets or towels. I could get her a little bit more comfortable if I needed to, you know, just to put her hands up. Sometimes it's a little more comfortable, but, you know, kind of have to just play it by ear. All right, so then what you want to do initially, let's say I'm going to work on her left shoulder. So the first thing I want to do is I want to cover her entire area. Let me get her all covered up. No sleeping. Okay. And I like to make sure that everything is covered. Okay, so then what I would do is I would get ready to get her shoulder ready. And one of the ways I would do that is I'd just kind of go under and I would bring her arm out. Okay? And then I'm going to bring her so, and I want to make sure that she's covered everywhere but where I'm going to work. Okay? So I can even bring this up and tuck it a little bit underneath so that if I'm going to use ultrasound gel or massage oil or whatever, it doesn't seep down underneath her. I just kind of tuck that up in there so that the whole area is good to go. Now I steal this back, and if I was, you know, wanted to, I could put a little bit of a buffer up here by her neck so that it didn't get up in her hairline or anything like that. Okay, and we just kind of, so now I'm really just working on this area. I just want to make sure, yeah.
If you're treating her shoulder, why are you covering like everything?
You just, now if you don't, this is how we explain it to you. Now, if in reality, is this always going to be the way you do it? No. Okay, if I'm in an outpatient clinic, I'm probably not going to cover her totally. If I'm in a skilled nursing facility and this patient only has a gown on, okay, if they're, you know, I'm going to cover them, one, and make sure they stay warm. I'm going to cover them for privacy, okay? So, depending on what area, what clinic you're in or what area you're working in. Yeah, okay? So that is for shoulder. All right, now if I was going to work on her legs, so if I'm going to work on her leg here, again, I'm not going to just whip this all up. I'm not just going to, you know, pull it all up and go, okay, so we're going to work down here now. I'm going to keep her covered. I'll tell you a funny story after we're done.
Oh boy.
So I'm going to work on her left leg, and I'm going to work, let's say I'm going to work up towards her groin. I'm going to bring this up and just put it kind of in the middle, like so. I give myself a little room. I'm going to just lift her leg up. Now when I do this, I like to get as much of her leg as I can. I don't want to just pick her up by the ankle and, you know, pull this in. You want to support the joints, and so I come under and I kind of cradle with my arm and support the whole limb and bring it up. Now, a lot of people want to help you, and I'll say, it's okay, you can relax. I can pick you up here. And so what I do here is I kind of tuck up to the area I need to go, and I set it down, and then I'm going to just firmly pull. You can see that that just kind of pulls that right up where you need it. Now, I would also include, if she had shorts on, I would just take the edge, and I'd say, I'm just going to tuck this so she knows what I'm doing. I'm going to include that in there now so that when I do pull this, it's kind of going to give me a little bit more room there, okay? This is great for tucking for men, getting the boys out of the way so that you can work on that inner thigh, okay? So it's a nice little way to protect yourself from bumping into things you don't want to be bumping into. Okay? And now she's completely covered. I'm only exposing the area that I want to work on. I mean, how does that feel? I mean, you're covered everywhere except for that area. Do you feel like you have exposure, or?
Oh, it feels good. And the fact that you do like the little tug at the end, just to, because then you can feel exactly where the sheet is lining your leg,
Yeah.
and that you're not exposed. Because if you don't tuck it, it feels breezy, and if it feels breezy, then you think you're exposed. So even if you're not visually seeing even if the person's not visually able to see, if there's not that tightness there and that air coming through, people will feel exposed. So that's a really good comfort.
Okay. Cool.
That's good.
So once you're done, you're going to just reverse what you did. You're going to lift her up, bring the sheet out, and make sure you don't, because you did tuck it up into the shorts, you may want to just first kind of bring that down so you're not exposing anything that you don't want to. And again, just making sure, you might want to just say, do you want to pull your shorts down a little bit before there you go, great, okay. And then you're good to go, okay? All right, so let's say we're just in a outpatient clinic and she's laying on the table and I'm going to work on